1 in around 50,000 children worldwide are affected by P.F.I.C, a rare inherited liver disease which causes severe itching. And the impacts on families can be devastating.
For children like these living with progressive familial intrahepatic cholestasis, quality of life is diminished and life expectancy is significantly reduced. P.F.I.C has the highest incidence of liver cancer of all liver diseases. But in daily life, it's the pruritus, uncontrollable itching, that causes most distress.
The kind of itch that Eleanor experienced was from the inside out. So it was a bit like, the way I used to think of it was her internal organs were itching and she couldn't get to them. And her blood was itching, but she couldn't get to it. This was something that started usually in the evening and lasted all night. She would scratch herself till she bled. Sleep deprivation is a form of torture, and it was torturous.
P.F.I.C is caused by genetic abnormalities in the formation and transport of bile, a fluid that drains from the liver into the intestines, removing waste products from the body. In P.F.I.C children, bile acids accumulate in the liver and can spill into the blood, causing liver damage and the severe itching. Biopharmaceutical company Albireo is one of a number of companies investing heavily in research to address rare liver diseases like P.F.I.C. Professor Richard Thompson was a PhD student when he discovered the main gene for P.F.I.C. He says research into new treatments is key as clinicians seek to prevent disease progression to liver cirrhosis or cancer and to reduce the need for liver transplants.
This group of conditions really have a retention of these bile salts in the liver because they're not being excreted normally into bile and getting to the intestines in the normal manner. And the accumulation of those bile acids in the liver causes damage to the liver and causes a whole series of other chemical effects which result in the other extrahepatic, so symptoms in the rest of the body. And we've gone to all sorts of lengths to try and improve the symptoms of these patients. But to cut a long story short, many of those patients have ended up having liver transplants, specifically because the quality of life and the itch is so bad. And to put a child through a major surgery like that, actually putting their life at risk as a consequence because of a symptom like itch, will probably sound extraordinary to most people, but that is the nature of what we're talking about. It's sufficiently bad that families readily did that to try and cure the problem. It's really a failure of our armamentarium that we've resorted to something as extreme as that. Based on the surgical data, it looks like if you can really change the biochemistry, change the natural history of the disease, all these other complications are avoided as well.
Alison Taylor of the Children's Liver Disease Foundation says that reducing the trauma caused by P.F.I.C is a major aim of research. P.F.I.C patients suffer greatly from sleep deprivation, pruritus, and travelling to specialist centres, plus the long-term risks of liver transplants.
It's been really heartbreaking sometimes to hear of the personal stories and see the pictures of children that have been so severely affected. Pruritus is one of the most devastating impacts of the condition. It has a huge effect for them. It can affect their sleep, affects the mother's sleep, the father's sleep, and the wider family's sleep. And that has knock-on effects to their everyday life and their ability to concentrate, to be able to give themselves fully at school. It can be really, really debilitating and can be something that affects all sorts of normal aspects of a normal life and make things incredibly difficult. In the past, it's meant that children do have some treatment options. Those are the use of off-label drugs that don't always work or don't always work consistently. There has been some surgical interventions which include a stoma bag and having a stoma bag with bile draining, which, as you can imagine, with young children is difficult. And then, of course, there's the potential that people have to go onto the transplant list.
With new research from companies committed to finding solutions for PFIC, families may one day find relief from the devastating impacts of this rare disease.